Good morning and welcome. You are tuned in to a webinar brought to you by the Mail and Guardian. This one is very special. Today we commemorate World AIDS Day, and in association we're being hosted by UNICEF, by the South African National AIDS Council, the Department of Health and the Department of Basic Education. They've all teamed up and brought us a panel of wonderful experts who are going to impart on us their working knowledge and their experience in this space. The theme for this discussion, a very important discussion, is centering adolescent girls and young women in HIV prevention and COVID-19 responses while engaging with adolescent boys and young men. And this conversation couldn't be more perfectly timed as we enter in almost the end of a second year as we deal with the COVID pandemic. And the conversation around the battle to get ahead of the AIDS issue is, of course, something that has never gone away, and now even more important. We've got a list of really great panelists to talk with us today. Amongst them is Sego Debeila. He is a public health specialist with the Center for Disease Control. We've got Dr. Precious Garnett. She's a marketing manager and medical advisor at Cipla. Coceka Nogoduka is the Chief Director for Care and Support in Schools. She's with the Department of Basic Education. Then we've got with Mothers to Mothers, we've got the program's Technical Advisor, Phineas Muchenjekwa, and the Director for HIV Prevention Programs, the National Department of Health. She's Dr. Thato Chidarikire. She'll be joining us a little later. Professor Ameena Goga, she's the Director of HIV Prevention, the Research Unit with the South African Medical Research Council. And with the South African National AIDS Council, we've got their Technical Advisor, Hilary Nkulu, and she works specifically in the space with adolescent girls and young women. And then a little later on, we'll be meeting the South African National AIDS Council's Youth Ambassador, Coceka, and she'll be chairing a very important plenary discussion that will form part of this webinar a little later on. So those are the people that we can look forward to learning from and hearing from today. We, from a housekeeping point of view, if you've joined the Mail and Guardian webinar before, we've got a little comments section on the side. Please feel free to post questions there, to post comments there. We've got so much to get through. So the first part of this conversation will very much be for our experts to bring to us the latest in their fields of expertise. They'll have slides that they've worked very hard on to try and make everything more understandable, but please feel free to engage with them on that comments page, and we'll try and get to them, as many of them as possible, specifically during that plenary conversation a little later on. We are kicking off right now, so let you not see too much of me. I'm Marcelle Gordon, by the way, and I'm just here to make sure we get as many of our expertise out in the open for you to engage with. First up, we have UNICEF's representative in South Africa. That's Christine Muhigana. I'm sure you've come to know her on various media platforms as we've battled this COVID pandemic, and UNICEF has continued to be at the forefront of that as well. She has been in this specific position since just September last year, but she's done amazing work with her team ever since. She's been with UNICEF for more than 30 years, or been with the UN rather, for more than 30 years. So she brings with her a raft of experience. Christine, over to you.
Thank you, and good morning, Marcelle. A very good morning to all participants in this important webinar, including representatives of government departments, NGOs, fellow UN agencies, development partners, parents, and most importantly, adolescents who are at the center of our reflections today. As we commemorate World AIDS Day tomorrow, we are reminded of the fact that so many people living with HIV in South Africa today are actually living healthy, fully functioning lives with a similar life expectancy to people not infected with HIV. It is also worth noting that South Africa has the biggest antiretroviral program in the world, and the PMTCT program has made considerable strides towards eliminating mother-to-child transmission of HIV. Yet, despite the successes of these programs, much work still needs to be done to protect all population groups against HIV. And adolescent girls and young women have been disproportionately affected by HIV/AIDS. The incidence of young women aged 15 to 24 years is estimated at 1.51%, which is about threefold the male rate and constitutes more than a quarter of all new infections. The HIV incidence among adolescent girls and young women remains, unfortunately and worryingly high, and more than 400,000 children and adolescents are currently living with HIV in this country. AIDS is the top cause of death in girls aged 10 to 14 years, and poverty, unemployment, gender-based violence, mental ill health, substance abuse, and unwanted pregnancies are driving HIV infections. The COVID-19 pandemic and the related infection prevention control measures have unfortunately also increased the risk of GBV and HIV infections. Substantial efforts have been made to reduce the effect of HIV on adolescent girls and young women through combination prevention approaches and initiatives such as the DREAMS and the She Conquers campaigns. HIV biomedical prevention interventions such as pre-exposure prophylaxis or PrEP and HIV self-screening have been introduced, but with limited success up to today. The call to action for all of us today is to achieve the zero new infections among adolescent girls and young women towards ending HIV by 2030. And so girls and young women must be placed at the center of the HIV response. We must also remind ourselves that young men and boys are key to prevention efforts. Programs such as the Ameena campaign and Men's Corners need to be intensified at facility and community levels. As well, parents and caregivers play a pivotal role in the lives of adolescent girls and young women, and we will not be successful in our efforts without engaging them as well. We need to regroup and to challenge norms and behaviors that promote stigma and prejudice. And if we fail to do so, there could be a resurgence of HIV among adolescent girls and young women as the largest population of adolescents moves into adulthood. This World AIDS Day webinar is an opportunity to share experiences, knowledge, and practices that place adolescent girls and young women at the center of our HIV response efforts. The United Nations Children's Fund, UNICEF, is committed to ending AIDS by 2030 and to work together with SANAC, all government departments, civil society, parents, and of course young women and young girls themselves to prevent the spread of HIV, to prevent the spread of GBV and that of COVID-19. It is my wish that we will leave this webinar with concrete next steps to intensify and scale up our efforts to ensure that adolescent girls and young women can live their lives free of disease and make choices not just to survive, but to thrive. I very much look forward to our discussions this morning, and thank you for your attention.
Thank you so much. That is Christine Huyigana, the South Africa representative for the United Nations Children Front. Thank you for setting the tone for this discussion. Over to you now, Rudy, for this a very special message. Professor Goga, if I could just stop you there. Unfortunately, you are on mute, and it allows me an opportunity just to introduce you correctly. I do apologize. We did have a miscommunication in our running order there. Prof, you've seen her face. You haven't heard her just yet. That is Professor Ameena Goga. She is the director of the HIV Prevention Research Unit at the South African Medical Research Council, well known in these very, very important circles. She's a pediatrician within the Department of Pediatrics and Child Health at the University of Pretoria, and the list goes on. She has a master's degree in mother and child and health epidemiology, and more recently, she's been focusing her work in the COVID-19 diagnosis space and on vaccine studies, which also means time is of the essence for this woman, because she has given us of her time, but she has to rush out very soon because she's very much a part of this ongoing battle against COVID-19. Professor Goga, over to you.
Thank you very much for the introductions, and at least now I'm not on mute. So sorry about that. But thank you very much for the opportunity. And I think it's really a very opportune time to talk about centering the responses to HIV and COVID-19 around adolescents. And as I go to show you the slides that I have, I want to bring to focus two main questions. So why should we focus the response to HIV around adolescents? Secondly, why should we focus the response to COVID-19 around adolescents? They certainly haven't shown to be the age group that is at most at risk for morbidity and mortality. And thirdly, I'll go through a couple of suggestions. So just to say, or to answer the first question, why to center the response around HIV around adolescents? And the one stark thing to notice is that in 2019 in sub-Saharan Africa, so at the top left-hand corner of the slide, you see that adolescents comprised 10% of the population. So only 10% of the population, but they accounted for 59% of new HIV infections. So as we know, something's going on in this age group that makes them at higher risk. And as they move forward, what we really want to do is to say, well, if they comprise 10% of the population, let them comprise no more than 10% of new HIV infections. The second point to bring forward is that in 2017 in Eastern and Southern Africa, 79% of new HIV infections amongst 10 to 19-year-olds were in females. So it brings to the fore the risk that adolescent girls face in Eastern and Southern Africa. And if you convert that to a daily statistic, each day 460 adolescent girls become infected with HIV. And thirdly, more than 90% of deaths worldwide from AIDS-related illnesses among adolescents occurred in sub-Saharan Africa. The important thing to note then, if you extrapolate this globally, is that HIV is the leading cause of death for women aged 15 to 49 years. So included in that are young adolescents. And then HIV was among the top 5 causes of death for girls aged 10 to 14 years. And then on the bottom right-hand corner of the slide, which is from a report produced by the Global Fund, what they postulate is that by 2030, there will be a 42% increase in new HIV infections amongst the 15 to 24 age group. And some of that is purely related to population growth. So these are staggering figures, and they really relate to adolescents and young children who will go forward and become the adults of tomorrow. The second thing I want to highlight is why center COVID-19 responses around adolescents. Clearly, we've seen that they don't have the highest morbidity and mortality. And I think it really depends on how we measure morbidity and mortality. So we've been measuring it in terms of hospitalizations and in terms of deaths. And it's clear that the older age groups experience more morbidity and mortality from COVID-19. But what I really want to talk through is we need to look at the details. So we need to look at the fine print. What's staggering is that there have been school closures in approximately 143, maybe even more countries. Experience from the Ebola pandemics and epidemics, not pandemics, have shown that whenever you have school closure, there's an increase in teenage pregnancy and an increase in gender-based violence. So we were warned about that, and I remember putting together a presentation about that in November last year, so a year ago. And what have we found? Well, in August 2021, there were news reports saying that teen pregnancies in South Africa jumped 60% during COVID-19. So whatever we learned and whatever we knew from Ebola has come true for COVID-19 as well. And that secondly, there have been investigations that have shown that investing in not just schooling, but schooling and increasing learning, so increasing literacy, has been shown to reduce fertility in young girls, has been shown to reduce child mortality and to increase empowerment. And so I think if we take a life cycle approach, so if we take an approach that says what we're really doing here is building a generation of healthy people moving forward, that although COVID-19 is having increased morbidity and mortality in older people as we measure it now, as we move forward, the group to pay the most attention to are adolescents, and particularly adolescent girls, because they have been most affected by school closures. They are affected by teen pregnancies because of COVID-19. They may be affected by gender-based violence. And there are lots of mental health issues that have arisen that I've not put on these slides, but there are mental health issues that have arisen, whether you measure effects in China, the United Kingdom, the USA, or there's some qualitative data from South Africa. The COVID-19 epidemic has had mental health effects on adolescents. And as you move forward, what we're really wanting to do is support this age group so that we build a healthier future generation. So there was a study that was done, which is a systematic review. They looked at 249 studies, and they looked to see what are the risk factors for risky adolescent behaviors. Are there more proximal risk factors or distal risk factors? And in these 249 studies, 77% reported proximal risk factors, so closer to the adolescents for risky adolescent behavior. And these really related to socio-demographic characteristics like the neighborhood, the school, the peers, family patterns, and the presence of other adolescent risk behaviors. So on closing, what I really think we should do and what the actions are to drive our agendas forward and put together a healthy future for adolescent girls and young women in particular, we should focus on 3 big things. One is education. Keep schools open regardless, with infection prevention and control, regardless of what pandemic or epidemic we're faced with. Make sure that schools are not just open, but that adolescents and young adolescent girls in particular continue to have access to quality education and learning. So it's not just about keeping schools open, it's about learning. And this includes education on sexual and reproductive health, that health services should meet the social, mental, and physical needs of adolescents and young women. not just physical health needs, but social, mental, and physical, that we should establish or strengthen mental health services, that there should be user-friendly, accessible sexual and reproductive health services and interventions, and that at community level, we must really strive to provide safe environments and economic empowerment. We must have approaches that strengthen adolescent girls and young women so that they are able to make autonomous decisions. But we also mustn't forget about young boys. We need to invest in raising gender-aware, respectful male children, and encourage and support responsive caregiving by mothers and fathers. And then lastly, that all our interventions, whether they're structural, whether they're social, whether they're health related, must be guided by adolescent voices. And so I think I'd like to stop there and hand back to Marcelle as we take forward this discussion. Thanks so much, Marcelle.
Thank you so much. That's Professor Ameena Goga, the Director of the HIV Prevention Research Unit with the South African Medical Research Council. A very short presentation, but so very powerful. And statistics really do speak for themselves, but you need people like Professor Goga and the various teams she works with to really bring it to the fore. The statistic that first spoke to me immediately: in sub-Saharan Africa, adolescent girls and young women comprise 10% of the population, but they make up 59% of new HIV infections. Just let that settle in for a little bit. Also, I find it very important with the information she gave us about school closures, that this conversation is being brought to you in association, of course, with UNICEF, the South African National AIDS Council, but importantly, both the government's Department of Health and the Department of Basic Education. So important that these departments don't work in silos and that they are working together as we continue to battle this scourge. Let's continue now and welcome our next panelist. And with us, we've got Sego Debeila. Thank you so much for joining us this morning. He's the public health specialist for the Center for Disease Control. His main role there is to provide public health advisory expertise to the HIV testing services in the Centers for Disease Control in Durban, in the KZN office, of course, a very important space in the external partnership branch of the CDC's Global HIV, AIDS and TB program. And there he's implementing and supporting prevention programs under the President's emergency plan for HIV AIDS relief in South Africa. Sego, over to you.
Thank you, Marcelle, and good morning, everyone. My name is Sego Debeila, and I'm a public health specialist with the United States Centers for Disease Control and Prevention here in South Africa. So today I'm going to speak briefly about the teenage pregnancy situation here in the country and what we are doing as CDC, as well as what we can intensify already in order to address the issue of great concern. Over the past few months, as we can see from the slides, I'm sure we have all seen the increasing number of worrisome news headlines related to childhood and teen pregnancy here in South Africa. As we look at the stories in the media, we are reminded that early, unplanned, and unintended pregnancy is a complex issue, potentially resulting in a multitude of health, educational, social, and economic impacts for the mother and child, and that teenage pregnancy is also driven by a number of structural and social determinants and vulnerabilities, including poverty, lack of knowledge of sexual and reproductive health, lack of access to and stigma associated with contraception, stigma associated with adolescent sexuality, and presence of harmful social and gender norms, which further exacerbate early pregnancy risk through age disparate relationships and sexual and gender-based violence. As we dig deeper into the statistics, we have all likely seen a number of different measures of pregnancy trends in 10 to 19-year-olds across the nation and within specific provinces. And while there may be a difference in the actual numbers due to the different data sources used, and the different parameters used to generate estimates. The key take-home message and conclusion is the same. No matter the data source and no matter the precise number, there is a clear problem with teenage and childhood pregnancy here in South Africa, which urgently needs to be addressed. So, what is being done to address the issue? And what really can we intensify in order to ensure that our young girls are given the opportunity and freedom to live their best lives? South Africa has already taken some key steps through the development of policies and laws, which really serve to protect young girls and adolescents from falling pregnant, as well as to enhance the resilience of and opportunities for young girls who do fall pregnant. As previously noted, addressing teenage pregnancy requires a multi-sectoral approach in order to deal with the complex drivers. And as such, strategic plans such as the Gender-Based Violence and Femicide National Strategic Plan and legislation such as the Children's Act and Sexual Offences Amendment Act, which reach across sector boundaries, are also considered to be key components of our toolkit. To operationalize the supportive policies and legislation, we need to targeted programming and evidence-based interventions. So we will take just a moment now to look at the practical example of this in the PEPFAR DREAMS program, which is implemented in 24 high HIV burden districts across South Africa. The DREAMS program is a multi-sectoral combination approach to preventing HIV, GBV, STIs, as well as early pregnancy in adolescent girls and young women aged 10 to 24 years old. DREAMS applies a holistic approach to combination prevention by not only providing interventions targeting adolescent girls and young women, but also providing interventions targeting males who will be sexual partners of adolescent girls and young women, as well as parents and caregivers of these adolescent girls and young women, and also the interventions also targeting communities as a whole. Okay. So in 2020, the MRC and the University of Cape Town conducted a systematic review which evaluated the events of effects of prevention interventions or for unintended adolescent pregnancy. And the authors concluded that multi-component and multifaceted interventions, which include educational, I don't know why my slide is not moving. I'm sorry about that. Yes. Yeah. Okay. So in 2020, the study conducted by MRC and University of Cape Town conducted a review which really evaluated the effects of prevention interventions for unintended adolescent pregnancy. And the authors concluded that multi-component and multifaceted interventions, which include your educational and contraceptive promoting components, had the potential to reduce unintended pregnancies among the adolescents. Now, these findings reinforce the multi-sectoral approach of dreams and initiatives such as the She Conquers campaign that we have in the country. And then issues such as stigmatization of adolescent sexuality and the use of sexual reproductive health services, as well as lack of support from parents and health workers, act and facilitate as barriers to youth-friendly SRH services. And as such, the DREAMS program assigns high importance to the vital combination of positive parenting, non-judgmental, supportive, youth-friendly health services. And other publications, of course, have revealed that parental mental health impacts parent to child communications and positive parenting. impacts which programs such as parenting or lifelong health and family matters aim to mitigate, as we can see on the slide. Thank you. In conclusion, the unintended and unplanned teenage pregnancy is a complex, multifaceted issue which urgently needs to be addressed in South Africa, and we have the tools and we can intensify their use, such as ensuring that we are implementing the supportive and protective policies and legislation, and also holistic comprehensive prevention programs, which really include education for adolescents and young people, parents and caregivers, as well as communities and community leaders. Also, the interventions such as positive parenting and supportive non-judgmental communication, and also supportive non-judgmental services to enhance sexual and reproductive health access and uptake, as well as economic strengthening of the adolescent girls and young women. That's my last slide. Thank you so much, and over to you, Marcelle.
Thank you so very much. Sego Debeila, public health specialist with the Center for Disease Control. And thank you to you and your team for the really important work that you do and for bringing those points to our attention. Let's talk is what that last slide said. That is so important. It seems to be a golden thread through all of the work being done, the need to talk, the need for non-judgmental communication and services to be provided, specifically to these groups that we're focusing on today, adolescent girls and women, and also how that then can include adolescent boys and girls in this ongoing, very important conversation. Let's not waste any more time now. On to our next speaker, and she is Coceka Nogoduka. She is the Chief Director for Care and Support in Schools with the Department of Basic Education, another very, very important part of our government, especially over the last 2 years specifically. Ms. Nogoduka is a public health specialist with almost 20 years experience within the HIV and TB space. She's also worked in various NGO organizations, and that includes the space that our previous speaker has also worked in, which is the President's Emergency Plan for HIV/AIDS Relief in South Africa, PEPFAR, as those in the know call it. She's a seasoned practitioner in HIV and TB response space, policy implementation, stakeholder management, resource mobilization, strategic information management services, and good governance. She's really, really the right person to hear from today. And she will be focusing on the implications of COVID-19 for delivering comprehensive sexual education. Coceka, over to you.
Thank you very much, Marcelle, for that wonderful introduction. And good afternoon, good morning, good evening to all our participants across the globe. And as the Department of Basic Education, we are really grateful to get an opportunity to participate in this conversation today. And also would like to thank the Mail and Guardian for shining spotlight on adolescent girls and young women, not leaving the boys behind during this World AIDS Day, as it focuses really on ensuring that we end inequalities. Therefore, it means we really need to focus on the adolescent girls and young women while we are striving to end AIDS by 2030. So my topic today, implications for COVID-19 for the delivery of comprehensive sexuality education. Colleagues, just to give you a bit of a background on what CSE is, as you've heard from Professor Goga, the statistics that she had shared with us and the intersecting pandemics that are affecting our adolescent girls and young women, as well as our adolescent boys and young men, in terms of HIV infections, unintended pregnancy, gender-based violence, including sexual exploitation, and then the backdrop of that, our mental health challenges that we are seeing amongst these adolescents. And as a Department of Basic Education, we hold more than 12 million of this age group that is affected. And as we all are aware, the South African law requires that all learners of school-going age it's mandatory that they are at school. So we've got this capped audience of 12 million people sitting in 25,000 schools across the country, that also as the education sector, we have to contribute as directed by the National Strategic Plan on HIV, TB, and STIs, that whilst SANAC is responsible for coordinating the HIV, TB, and STIs response in the country, we all have to contribute to that NSP, and as the education sector, we also had to contribute. And looking at the mandate of the Department of Education, which is teaching and learning, we decided to contribute with the component that we best know how, which is increasing knowledge as well as influencing behavior by ensuring the implementation of the sexuality education program. So CSE is really a program that is part of our life orientation subject. It means it contributes to the curriculum, therefore it's evidence-based, it's age-appropriate, it's content coordinated, as well as it's incremental for our learners as they go through the schooling age. But as we were continuing to implement CSE, I think all of us are aware that despite the fact that the life orientation subject that had components of CSE started to be implemented by year 2000, as we were focusing on strengthening the implementation of CSE by developing scripted lesson plans as a department to ensure that we support our educators to continue implementing CSE, we were really then confronted with a lot of resistance from the faith-based sector, from some of the parents, and from some of the organized NGOs that are on the far right of Christianity. And they organized themselves to really fight the implementation of CSE. But with the stakeholders that we were working with and the support of the evidence that was out there, CSE continued to have friends to support, but also CSE continued to gain mileage for implementation. As we were gaining momentum, COVID-19 came, and as the country was battling with responding to COVID-19, we had to close the schools. And I think you've heard from Professor Goga and her colleagues as they were advising against the school closure, but the country was under immense pressure and nobody knew how to respond to COVID. Therefore, schools were closed. And that left our children floating at homes, floating in the streets, and the department scrambling with how to ensure that we continue to provide a curriculum content to our learners while they were at home. So with COVID-19, we all highlighting the challenges that we faced as a country. We had challenges that we had to face as the education sector, but COVID-19 as the education sector provided us with a once-in-a-lifetime opportunity to implement the curriculum differently. We had to look for different and innovative approaches that would make sure that we are able to supplement the implementation of the curriculum through the digital space. Access to face-to-face CSE inside and outside of the school settings was reduced. Therefore, we had to improve accessibility and effectiveness of ensuring that our young people continued to access information during difficult times. We had to ensure that we're improving the fidelity of the content whilst the educator was not in front of our learners. Then the department joined the world, joined the country in exploring the digital space in implementing the curriculum of CSE. In terms of the products that we currently have as the Department of Education, we have developed CSE radio lessons that will be kickstarting in January to make sure that our learners will continue to have access to the information, also leading them to services that they require, especially the SRH services during lockdown. On Sunday, we launched Breaking the Silence. This is a TV series also focusing on giving out CSE content in a TV edutainment kind of approach. We have launched this TV series and it will be screening on SABC 1, 4:30 p.m. every Monday, starting on the 3rd of January 2022. And this program is also going to assist in ensuring that it addresses the taboo and difficult topics that parents find themselves difficult to engage with learners. And we are hoping this TV series will provide a platform to continue those conversations as aligned with the CSE different modules. We have started also providing an online training and orientation for our educators so that our educators can continue being empowered to deliver CSE inside the classroom and outside the classroom. In the year 2022, as we continue with our digitalization process as a department, we will be providing the actual online CSE delivery to ensure that our learners will continue to access CSE in case the country finds itself to another lockdown. So in terms of the access to the digital CSE, I think we all know that our online interaction, or that what we found, that contrary to the understanding and the belief that our young people are always on floating on the multimedia spaces, the online interaction was not easy for everyone. We also noted that the majority of learners that had access to the digital CSE spaces were those that were in the urban areas. Therefore, the issues of the digital divide in the country will continue to impact on the different platforms that we are giving, as well as the department needs to be working with other stakeholders as we are looking at how do we ensure access to the different digital platforms for the different populations in our country. Other challenges came up as the department as we were trying to facilitate the delivery of CSE in the digital space. We had to ensure safeguarding of our young people that participated in the digital space, because now we were exposing them in the online space, and the issues of cybersecurity had to kick in. As one of the modules of the CSE, we do have a module that talks about safe online interaction, safeguarding yourself while you are online, as well as addressing issues of cybersecurity and how to ensure that you protect yourself while you are spending time on the screen. That module is also was then also elevated as we were putting out the digital spaces for CSE. We had also to ensure that we guarantee a better safeguarding of our young people accessing the digital information online. In terms of how we take forward the CSE digitalization as the department, we are engaging with young digital content creators and users so that we ensure that we remain vibrant in the digital space. We remain attractive with the information that we are providing, but also ensure that the content that we are providing is age appropriate, language safe, and culturally sensitive, as well as ensure that the dignity of the learners continue to be maintained. As we make the digital sexuality education as safe and more accessible, we have to make sure that we empower our young people to be able to navigate the media space, the digital media space, so that as we ensure that they get access to information, but also to services that they require to prevent them from new infections of HIV, improve their knowledge of SRH services, but we don't expose them to sexual exploitation on the website. We need to understand the politics and the power structures of the digital world. Like any other space, like any other commodity that is out there, there are politics that are around and are behind it, and there are power structures that you require to understand for you to navigate that world. So we are also trying to make sure that as a department, working with other government departments and our social partners, we get to understand how the digital world works so that we can ensure that our information remains safe when we expose it into the digital space. We are endeavoring to provide comprehensive, sustainable, and continuous professional development of our educators and our teachers to ensure that they are digitally competent. While we are exploring the digitalization of the CSE interventions and the CSE programming, we want to ensure that our teachers and educators remain in the forefront of delivering the information as the trusted agents of delivering information. So from us as the Department of Basic Education, while we work and collaborate with all the relevant structures and systems that are ensuring that we continue to keep our learners safe, We continue to keep our learners knowledgeable. We continue to protect our learners from HIV, and aligning ourselves with COVID-19 and the implications and the impact of COVID-19 that continues to have to our learners. We also want to make sure that we continue protecting our learners from exposing them to an unwanted world of the digital space during these times. Thank you very much, Program Director. I'm handing back to you.
Thank you so much for that. That is Ms. Coceka Nogoduka. She's the Chief Director for Care and Support in Schools at the Department of Basic Education. Wow, what a massive job and task you and your teams across the country have. Not just even before we heard of COVID-19, but now even more so. In the olden days, the teachers used to deal with their kids only in the classroom in front of them and focus on also their life at home. Now we've got all of these digital platforms that they need to keep an eye on as well. And so much to learn as they continue to try, as you say, to keep our learners safe and to educate them. As you said at the beginning there, your job is to increase knowledge and to influence behavior, and do so to the best of your abilities. And it seems those plans that you've put in place is aiming to do just that. Thank you so much for that presentation and that great insight. On to our next panelist now. We've got Mr. Phineas Muchenjekwa. He's a Program Technical Director with the organization Mother to Mothers. Thank you so much for your time this morning. Phineas has been supporting the strategic planning and proposal writing and working on the South African Mentor Mother program since he's joined the organization back in 2016, but is now the technical lead for the Adolescent Girls and Young Women project at that organization. And today, Phineas will be speaking to us about how we can improve HIV testing and ART adherence for adolescent girls and young women through peer mentoring. Phineas, over to you.
Thank you very much, Marcelle. Good day, colleagues all over the world. My name is Phineas Muchenjekwa. I am a Program Technical Advisor at Mothers to Mothers South Africa. Today, I'm going to present our work on the Adolescent Girls and Young Women's Project, which we are implementing in South Africa, and how it can assist in improving HIV testing and adherence among the adolescent girls and young women in South Africa. Mothers to Mothers is a non-governmental organization which trains and employs local women living with HIV to serve as frontline health workers and assist understaffed health centers and communities. These mentor mothers, they assist women and their families in linking them to care, supporting them with vital health education, as well as supporting them in accessing treatment and retention in care across all the countries which work in Africa. So a quick snapshot of the adolescent girls and young women's context in South Africa. The previous speakers have painted the picture on what the young girls are really facing. According to the Stats SA, by 2018, around 36% of South Africa's population was made up of the youth. And most of these youth are unemployed and they don't have skills. Some of them, they are facing unemployment and the double stigma of being HIV positive, as well as being pregnant whilst they are young people. They are also victims of gender-based violence, which includes intimate partner violence, physical abuse, rape, and all those issues. There are a lot of programs which are in the country, and the previous speakers have outlined them, the DREAMS, the YOLO programs, others which are done by the Department of Basic Education. Most of them, they are there to assist with the prevention of teen pregnancy, with the prevention of HIV infection. But then the question comes, when they become pregnant or when they become HIV positive, who is there to support them? So seeing that we had limited programs or interventions to assist these young girls, Mothers to Mothers developed what we call the peer mentor model, which is derived from the original Mentor Mother program, which Mothers to Mothers has been implementing for the past 20 years and has been adopted as a global plan in ending mother-to-child transmission across the globe. It is designed to ensure that those girls who unfortunately find themselves pregnant whilst they are young and become HIV positive, they receive appropriate and relevant care. And this program is there to provide them with facility or household-based psychosocial support and health education so that they could access relevant, quality, as well as timeous PMTCT services, maternal and child health services, as well as nutritional services for themselves and their children and their families. So at the center of this model is a young woman who serves as a mentor. But this young woman is someone who has traveled the journey. So we believe that the mentoring, unlike other interventions, should be based more on experience rather than on theoretical knowledge. We identify a young woman within the local area who has traveled the journey of being a young mom, whose HIV status is known, and that woman must be willing to disclose their status to their peers. So they provide peer-based mentoring and service provision. This will be done through day-to-day interaction when the clients come to the facility, which is also coupled with follow-ups when they are at home, either through phone calls or through social media. We also use the integration of MNCH and HPRU services so that we provide both the antenatal and postnatal care and integrate them together with the standard HIV testing modalities. We also promote the issue of engagement with these adolescent girls themselves. They must be at the forefront. And we also link our clients together with the Department of Social Development, Department of Health, and the Department of Basic Education to ensure that those girls who return back to school whilst they are young mothers, or maybe they're HIV positive, they continue receiving care even at school facilities. But what is at the center of this mentoring approach? We provide a safe space or a safe haven for these adolescent girls and young women so that they engage with their peers without fear of judgment, misunderstanding, harassment, or abuse. We understand most of them, they are young. It might be the first time they are getting pregnant. Some of them, they become pregnant and when they go to the facility, they test HIV positive. That creates trauma. Psychosocial issues need to be provided. So this mental model provides them with that space where they share with their other colleagues, where they share with a peer, someone who has traveled the same journey, and provide them with practical life skills to cope with being pregnant as well as being HIV positive. We also provide a platform for role modeling so that through this peer mentor, we improve and influence the other new clients so that they can have an opportunity to develop a positive self-concept and self-acceptance. In this current period of COVID, they face a triple burden. They are HIV positive, they are young, whilst they are pregnant, and they also face COVID. So who is there to assist them? That's why we believe that this peer mentor mother model should be there so that they walk the journey together. They travel together and they become friends. We also promote empowerment for these adolescent girls so that they could develop personal resilience and increase their knowledge on dealing with issues related to stigma, both which is related to either being HIV positive or also being a young mom. So this project, we have implemented it across South Africa. The mentor mother model itself has been implemented in 7 of the 9 provinces in South Africa. The Adolescent Girls and Young Women's Project has been implemented in Gauteng, Tshwane District, Ekurhuleni, City of Joburg, and in KZN, where we have got eThekwini and Umgungundlovu. In the past year, we have served around more than 25,000 adolescent girls and young women who are both pregnant and postnatal. We have seen that 63% of them are between 20 to 24 years. But what is worrisome is that 2% are between 10 to 14 years. This aligns with some news reports which we have seen in the past couple of months, where we are seeing an increase in our young girls below the age of 10 or around 10 who are becoming HIV, who are becoming pregnant. So our model is there to take those young girls and support them into young motherhood, to take them through that path so that at least they could cope with all the challenges that come with being a young mom, being pregnant, and also how to impact them with some good parental skills. Through the model, we have managed to ensure that 90% of our clients they got tested for HIV. 95% were initiated on ART. Birth PCR was around 68%, mostly because these young girls, some of them, they move. The test can be done, but they don't come to the facilities to collect their results. But from this project and from the interactions with these young girls, we have learned a number of lessons. And these lessons, we propose for them to be scaled up, to be considered as we develop long-lasting policies and strategies to ensure that on this World AIDS Day and going beyond, we support our adolescent girls and young women, including the young boys. Some of these lessons include the issue of creating a trusted bridge between these young women, their communities, and health services. Most of these young girls are afraid to go to the facilities when they are young and they are pregnant for fear of judgment, for fear of rebuke. But through the peer mentor model and the availability of the peer mentors who become friends, we have seen that these young girls, they adhere to their schedules for ART adherence, for ART pickup, even for the basic antenatal care services. They follow them because they know that there is someone who is based at the facility or within the community who has traveled the same journey as mine and is willing to support me. We also learned that there is a need for us to promote tailored psychosocial support, information sharing, and support from other peers, partners, and families, so that they don't feel as outcasts. Some of them might be pregnant due to issues which might not be of their own making. Some pregnancies we have noted are a result of incest. Some of them are a result of abuse. So there is a need to create a family-centered environment which supports both this adolescent girl together with the family, so that at least her journey through pregnancy and young motherhood is as easy as possible. We also promote regular engagement and risky communication, especially in this current period of COVID, because our young people, they are facing despondency. They don't know what is going to happen to them. They face being infected by COVID, they face being infected by HIV, but they also like to go out. They also want to enjoy life. So such confusion creates mental anxiety amongst them. So through the peer mentor model, we are able to communicate with them, allay their fears, and promote positive lifestyles among these clients. Adolescent girls and boys also, they need intense psychological support for lasting behavior change. We are also noted that the power of adolescent and young women in engaging the peers will result in more or less similar experiences, which will enable them to navigate the health system. Most of them, they've never been to the facility. The day they come to book for their first pregnancy, or maybe to test for pregnancy, is the first time they have been at the facility on their own. So through our model and through the availability of this peer mentor, we are creating that platform for these young people also to feel welcome, to feel part of the overall system. And lastly, but not least, we believe that through this model, we are providing an economic and empowerment opportunity for the peer mentor themselves through employment opportunities which are there, which on the other hand addresses the challenge of unemployment, but it also gives them a sense of value within the community. They feel a sense of belonging. They feel the need to continue living, irrespective of their HIV status, as well as being pregnant or have been young mothers. So we believe that with this model, we can create influence and empower a positive living among our young people who find themselves, unfortunately, either pregnant or HIV positive, or both HIV positive and pregnant at the same time. On that note, I thank you.
Thank you so much. That is Phineas Muchenjekwa, Program Technical Advisor for the organization Mother to Mothers. And Phineas, I need to thank you because I do feel that you've painted the picture of the heart and soul of this discussion. After all of these worrying statistics we're dealing with, you've really given us an idea of what these young women and girls are going through on a daily basis. They're pushed to the peripheries of their communities. They're facing stigma because they're HIV positive, and many of them are pregnant. They're unemployed. They don't have skills. And what they need is somebody to reach out to them, to influence them positively. And most importantly, as part of your peer mentoring program, you give them hope and an idea and a plan to feel optimistic about. And we thank you for bringing us that very important information and for the work that you and your team do on a day-to-day basis. If you've just joined us on our YouTube channel, this live broadcast is being brought to you by the Mail and Guardian. We're hosted by UNICEF along with the South African National AIDS Council and the South African Departments of Basic Education and the Departments of Health, as we continue this discussion on World AIDS Day for 2021, centering adolescent girls and young women in the HIV prevention and COVID-19 responses, and engaging adolescent boys and young men while doing so. Such an important part of that discussion as well. You are able to comment on this discussion as we head into the last few moments we have. Please let us know where you're watching from, where you're listening from. Give us your comments, give us your questions, and hopefully we'll have enough time in that plenary discussion to try and deal with some of them as well. So let us know that you are there. It will help our panelists feel part of our bigger community across South Africa, across the continent, and indeed across the globe. On we move now. Our next presenter is Ms. Hilary Nkulu. She is the Adolescent Girls and Young Women Technical Advisor for the South African National AIDS Council. She's got nearly 20 years of experience in public health, and that includes over a decade of work for the UK Department of International Development and Irish Aid, and that focus on East and Southern African region. And right now, her work focuses on this very important part of our population, Foundation, adolescent girls and young women, in her role as technical advisor at the SA National AIDS Council. And today, Hilary, you'll be focusing on scaling pre-exposure prophylaxis, the Adolescent Girls and Young Women Strategic Initiative. Please tell us more.
Great. Thank you very much, Marcelle, and good afternoon to all the participants at this webinar, as well as my fellow panelists. Yes, as Marcelle indicated, I think today the focus of my presentation will be on pre-exposure prophylaxis to adolescent girls and young women. And at the South African National AIDS Council, I mean, we're not an implementer, but as some of you will know, or most of you will know, that SANAC is responsible for coordinating the multi-sectoral response to HIV, STI, and TB. I will not dwell too much on the context, because I think previous speakers have spoken at great length about the statistics, both at a regional and context and local level. So what I'd like to focus on is just some of the challenges that we've experienced. Well, first of all, I'll put in context in terms of where are we as a country when it comes to the provision of PrEP to adolescent girls and young women. What are some of the challenges that we've picked up along the way? What are some of the lessons? And what do we need to do better in terms of reaching adolescent girls and young women? So as indicated, I'm not going to dwell too much on the statistics because that's been adequately covered by previous speakers. But perhaps from this slide, the one thing that I would note is the fact that, you know, it's really important for us to, when we discuss, the issues and the vulnerabilities that are faced by adolescent girls and young women, it's important for us to not only have the biomedical angle, but also to look at the social and structural issues. Issues that are affecting AGYW are multifaceted, which means our response also needs to be multi-sectoral. Hence, the work that SANAC does at a national level. So, what guides us as a country in South Africa is the National Strategic Plan. And in that plan, one of the objectives was to make PrEP available for all individuals identified as being high risk. And we all know that AGYW are a high risk group. We've made significant progress since the program started. In fact, the Department of Health has exceeded its target of initiating 85,000 girls on PrEP. And whilst we've made significant progress, there's still a huge gap, which is why right now the department is implementing a plan to scale up the delivery of PrEP, not only in primary healthcare facilities, but through community healthcare centers as well. And in this period that we've been implementing PrEP, we've learned some important lessons. We know what are some of the challenges, but also, I think it's important for platforms such as this as well. I think they provide us an opportunity to share those lessons across a much broader platform so that as we continue to scale up PrEP, we know what to do better based on the lessons that we've learned along our journey. The challenges are a lot, but I think I'd like to focus on 5 for this meeting. Well, the first one is, we've seen low uptake. So even though we've made significant progress, but the uptake of PrEP, particularly among this group, it's still very low. We also know that there's a lack of accurate knowledge, which often then leads to myths and stigma surrounding PrEP. But accurate knowledge is not only limited to AGYW, it also extends to the providers of PrEP, be it healthcare workers or community workers who are at the coalface when it comes to providing PrEP. So, which speaks to the really need to ensure that accurate knowledge is provided not only to the beneficiaries of our programs, but also the people who are doing the delivering of the programs. Adherence support, is also something that has come up over and over again across the different programs that are being implemented, and just the lack of support for young women who are on PrEP to be able to stay on PrEP. Parental support, again, it's something that has, keeps coming up over and over again. And lastly, partners, intimate partners, of adolescent girls and young women. Most of the time, I think, we learn that adolescent girls and young women are afraid, for instance, of disclosing or letting their partners know that they are using PrEP because they worry that the partner might end the relationship. So with those lessons, we've also been documenting, recommendations that we can share with partners who are on the ground implementing programs for adolescent girls and young women, particularly as we look at scaling up PrEP in all our healthcare facilities, but also with implementing partners such as the Global Fund, PEPFAR, and many others who are, engaged or involved in implementation. What are some of the recommendations? What do we need to do better in order to achieve our goal of scaling up PrEP? The first one really speaks to actually the title of this webinar, which is Centering AGYW in the HIV Response. And we talk a lot about centering young people actually in all our responses, but what does it mean in practice? It means that we need to be engaging with AGYW in a more meaningful way in all our processes. So we don't engage with them only at the end or when it's time for them to be given a service, but we need to be engaging with AGYW from the beginning of our processes, including when we're developing our policies. We need to be engaging with the young people when we design our programs, and they also need to be engaged in the monitoring of the services which are provided to them. Community-led monitoring, it needs to be championed by young people. So, and I think when we talk about meaningful engagement, it's such an empowering position to be in. So we talk a lot about empowering young people, but how can they be empowered if they're not involved, if they're not at the center of all our processes? And then demand creation strategies. I mean, I think we talk about demand creation a lot, but our strategies need to evolve and they need to be more innovative. We are at the time right now where there's social media, you've got multiple platforms, you've got apps and a range of other digital platforms. So how do we capitalize on that, to ensure that the message gets across or the message gets to the people that we are targeting? And when we talk about demand creation, I think we also need to be mindful of the language that we use. When we talk to young people, we need to, I think, most of the time, we make the mistake of seeing young people as a homogeneous group, and they are not. We need to be addressing the issues that young people face in a more holistic way. We're not looking at them just, we should not be focusing only on the health aspects, but let's treat young people as people. And, the language that we use is so critical because I think if you look at our processes, most of the time we talk about vulnerability assessment, risk assessments. It's almost, the language we use is often so judgmental. And I think we just need to be careful about the tone and the language we use to ensure that we don't alienate the very people that we want to bring on board. The previous speaker spoke about peer mentors and the importance of peer mentorship. And, I can't emphasize that enough. And I think we also, in addition to supporting with adherence, I think we also need to be looking at how do we incorporate psychosocial support in our programs, particularly right now. I mean, I think those of you, several speakers spoke about the impact of COVID, and many other issues that I think we've been battling with as globally in the past 2 years, and the need for psychosocial support actually has, it's no longer optional. I think it's become an equally important aspect of all our interventions when it comes to addressing young people. And I think the last two points I'd like to talk about, it's integration. Integration, I think that there are three ways that I've put it. I think there's the one thing when it comes to looking at the infrastructure in our health facilities. Young people do not want to be sent from pillar to post. So when a young person presents at a health facility, they need to be able to get all the services that they require in one place. So the importance of one-stop shops are really critical. And, so we need to look and, at how our facilities are set up in order for young people to be able to, make it easy for them to be able to get those services that they require. And then integration of the other services, such as sexual and reproductive health, including looking at options for contraceptives. The one thing that we talk about when we talk about SRH is choice. So we need to make sure that, as along with PrEP, young people have options when it comes to the contraceptives that they can that they can access. Family planning. That integration is so key, so that we don't do the silos or the our services really need to be integrated if we really want to have an impact when it comes to HIV prevention, particularly for adolescent girls and young women. And the last point around integration that I'd like to make is, as other speakers have also spoken about it, integration of AGYW programs with programs that are targeting adolescent boys and young men, as well as male sexual partners of AGYW. I think more broadly, I mean, when we improve this integration, it speaks to also it supports young people, especially when it comes to the challenge that I spoke to earlier around adherence support, but it also leads just to better retention in care for both the ABYM as well as the AGYW. And lastly, I think community engagement. Everyone has spoken at great length about that. We need to educate our communities to eliminate the stigma associated with PrEP and ensure that AGYW have the support from parents, guardians, and other care providers in our communities, as well as the homes in which they live. Thank you very much. I think that's all from me. Back to you, Marcelle.
Thank you so much. That's Hilary Nkulu. She is the Adolescent Girls and Young Women Technical Advisor for the South African National AIDS Council. So insightful. And like Sunette Pienaar commented there, saying, thank you for emphasizing the language we use with young people. Babalwa Mbono saying she likes the integration of services for adolescent girls and young women. And really that we can say for all of the work that we've seen being presented by our presenters. Alida Kekana, you've asked the question. You said, is it possible to get the recording? I believe you're speaking about this webinar. Normally, if you've registered for this webinar with the Mail and Guardian, our kind hosts today, they will email you the recording after this. But of course, if you are watching on YouTube, that link should remain there after we have closed this webinar. So you should be able to distribute that link as easily as possible as well. Let's continue going. We are running up against the time we set aside for this webinar, but I do believe a little birdie has told me we can go a little bit over time. So please don't go away at 12:30. Do stay with us. Right there next to me on the screen, you'll see Dr. Precious Garnett. She's the marketing manager and medical advisor for Cipla, and her space, it has really been, has such a variety in it. You've graduated from UCT, you've worked in the public sector within the Department of Health, you were in the Army, a senior medical officer there, and during your time with in the Western Cape, the 9th South African Battalion, you started a specialized HIV clinic caring for Army personnel and their families living with HIV. And believe this really was the golden thread fueling your passion. If you've gone on to work with the Desmond Tutu HIV Foundation and on you've gone, and you're passionate about infectious diseases, adolescent health, and global public health. And Dr. Garnett today will be talking about using gamification to increase the uptake of PrEP. Over to you.
Thank you so much, Marcelle, and for the lovely introduction. As Marcelle said, my name is Dr. Precious Garnett, and I come to you from Cipla, the pharmaceutical company that has really engineered access to affordable HIV medicines globally beyond just the South African borders. So, Rudy, I hope you'll be able to share my screen. Thank you so much. So I come to you today, and before I start, I also just want to acknowledge the Mail and Guardian. Thank you for the platform and organizing all of us together to commemorate this important day. But beyond that, bringing different sectors to really speak on the different interventions, the different thoughts, because it is important that we also share lessons within our different spaces as we continue to center adolescent girls and young women. I will not dwell on the statistics. My previous panelists have painted the picture very well, that we have the highest burden of HIV in South Africa in terms of the prevalence and the number of people living with HIV. But beyond that, we also have the highest new infections in the world. And these newest infections disproportionately affect our adolescent girls and young women. And I think it was Professor Goga who earlier shared that about 37% of these new infections happen in young women. 1,300. This was from a City Press last about 2 months ago, where they reported that every week 1,300 adolescent girls get infected with HIV. We've done a lot in terms of curbing this pandemic, and this is how we have the biggest ART rollout program in the world, but we still have a lot of work to do in terms of curbing the new infections. And Phineas spoke about the triple burden that this young girl child has to bear with the HIV infections, with pregnancy, etc. So Cipla has done something about this, and it does also connect with what Ms. Coceka talked about earlier in terms of the CSE program as part of the life orientation syllabus within the schools in South Africa. And what we've brought on is acknowledging the fourth industrial regulation and acknowledging that even within the South African context, COVID has accelerated digitalization. Where are the young people at? Right. Hilary before me touched on how we need to have innovative strategies that speak the language of the young person who's our target audience. So we've taken this as Cipla and we've worked very hard trying and reflecting on how can we educate differently. And we call this the re-education of the girl child. Rudy, next slide. So this is Live to Love, the game probably brought to you by Cipla for the young girl, but also not leaving behind the young boy and the parent who is the custodian of this young child. Thanks, Rudy. Thank you so much, Rudy. So that was a demo video just showing you how a player navigates the game. So there's 3 levels to the game. Level 1, the key messaging there being protect yourself. So you get introduced to Blue. Blue is young, single, and mingling as young people do. And your role as the player is to help Blue mingle safely, right? So you have to help Blue pick up the PrEP medicines that she needs to take to protect herself from getting HIV as she mingles. And then if you do that and you do it consistently and also pulling in the important messaging of adherence, then you move on to level 2. And level 2 is when Blue finds love and you get introduced to Sunny. And as they fall in love in level 2, they find out that Sunny is actually HIV positive. So then your role, with our main character being Blue, and your role across the different levels being to help Blue remain HIV negative. But in level 2, when she falls in love with HIV positive Sunny, you have to help Sunny take his ARVs so that he won't infect Blue. And the key messaging here being U equals U, untransmittable, undetectable virus means untransmittable. And if you do successfully help Sunny take his ARV and ARVs and Blue still remains HIV negative, you can then move to level 3 where they become pregnant. And now your role is not only to protect Blue from getting HIV, but you also need to protect the baby from getting HIV. And the theme here being protecting your family. And if you successfully go for your HIV test in the clinics or at your doctors, while helping Blue do that, and you still help Blue take his PrEP meds consistently, then there is, at the end of level 3, it is you get an HIV negative baby and a happy family, and HIV does not have to stop your happy ending. Yeah, so it is a love story, and we officially launching the game today. So everybody on this call, please do co-play, go share it widely with our young people, whether male, female, young or older. And that is why also, and what Hilary was speaking about earlier in terms of like the messaging and the language needs to resonate with young people. We know that the biggest burden of new infections is in adolescent girls and young women, but the young boys are also still at risk. And men who have sex with men are still at risk. Sex workers are still also at risk. So that is why Blue is non-binary, and Blue, as much as she's young, but she speaks to, Blue can be anybody. I am Blue, you are Blue. Blue is all of us. And also why Sunny is Sunny and not a boy or a girl. And why they become pregnant, and anybody can get pregnant. There's different methods of getting pregnant and building families. Okay, so that's in a nutshell the game. So in terms of bringing the game to market, we officially launched today. Yay! So everybody will have access to the game. Please do play, do share. But beyond just launching the game, there's been a lot of activities that we've been doing pre-game launch, and we'll be continuing doing throughout the ecosystem of the game. So I'm a firm believer that nothing about us without us. Engaging young people is very, very paramount. And it's paramount to understand, do they receive what you're educating them on? Are they receiving the information? Are you able to reach them? And are you able to get into the spaces where they're at? And this is the whole point of gamification, right? It's using the medium that they're engaging in on the everyday life. I imagine this game, a girl child taking a taxi to school, and in the taxi playing this game instead of Candy Crush. No offense to Candy Crush. So, but we've done a lot of focus groups engagements with all girls, all boys, mixed groups. We're engaging with civil society groups across the South African and global spaces, just to help guide and get some lessons from, because they would have been in the space for quite some time, and there's a lot of opportunity from learning from each other. And I'm so happy that the panel, my fellow panelists today, come from different sectors. Coceka, we need to this game needs to be a tool as part of the Department of Basic Education CSE program. But beyond that, we are planning to have tournaments across the country in high schools and youth centers. And I hope everybody will be as excited as we are about this game. And we hope ultimately that it does affect the behavioral change that we wish for it to. Thank you so much, Marcelle, and thank you to the audience.
Thank you so much. That's Dr. Precious Garnett. She's marketing manager and medical advisor at Cipla. I, for one, can't wait to find out what happens next for Sunny and his family. So stay tuned, I suppose you would say, to that game. Thanks for bringing us that, a little bit of light and color and hope to this conversation. Let's move on very quickly now. Time is against us. Our next presenter is Dr. Thato Chidarikire. She's the director for HIV prevention programs at the National Department of Health. And today, the good doctor will be talking about centering the needs of adolescent girls and young women in the future pandemic responses. Of course, that's what we've been speaking about throughout today, including those related to HIV, COVID-19, and GBV, policy and program implications, including PrEP policy and implications, of course, for our adolescent girls and young women. Dr. Chidarikire, if you are there, over to you. Okay, unfortunately, we seem to be having problems with the link to Dr. Thato Chidarikire. So we're going to have to move along for now. And it's time for our plenary discussion. And to do that, I'm going to introduce you to our National Youth Ambassador at the South African National AIDS Council. That's Coceka Ratumbu. Coceka, thank you so much for being patient. Such important information and insight we've received over the last hour and a half or so. And you're going to be taking us forward on this. Coceka is also a member of the Generation Equality Forum Youth Task Team and the GEF advocate for Action Coalition, focus on SRHR and bodily autonomy. Coceka, run with it.
Thank you so much, Marcelle. Thank you so much, colleagues, for really joining us on this very important discussion. I just want to start by saying that today's theme really encapsulates one of the most definitive steps in ensuring that we achieve an increased reduction of the number of new HIV infections and pregnancy among adolescent girls and young women, and ensuring that in doing so, we do not leave the adolescent boys and young men behind. By now, we all agree that the need to address young people holistically persists, particularly because we know that they do not exist in silos and that their challenges and needs are interwoven. So in recent years, a link between poverty, inequality, unemployment, and risky sexual behavior, as well as alcohol and substance abuse, has been identified. So the lack of economic advancements, particularly for adolescent girls and young women, has resulted in age-disparate relationships between AGYW and older men, and in the effort to secure monetary items in exchange for sex. So these conditions make condoms and the increased needs to negotiate condom use quite difficult, and also enable the lack of control of reproductive choice and increased vulnerability to sexually transmitted infections among this cohort. So research and also our social observation has taught us that the lack of youth empowerment and transformation of the lives of young people drives negative coping behavior such as risky sexual behavior and the aforementioned issues. So mental health support also is another fundamental area which requires us to support young people given the conditions of their lives and the challenges that they faced with, including the effects of COVID-19. which has really presented us with the task to also support young people in this area and ensure their overall well-being. So a collective effort between government, communities, the organizations such as the South African Depression and Anxiety Group, Tutuzela Care Centers, and other key implementers of such interventions should continue to maximize the efforts to ensure that mental health support related to depression, anxiety, and other mental health conditions faced by young people are addressed. So young people need to be given more than a platform or a role to merely endorse processes, but rather a well-capacitated voice to ensure meaningful and informed contribution to processes. So capacity building then becomes one of those fundamental foundations which governments and partners should focus on immensely. This would be through capacity building workshops, ensuring that young people who sit in these decision-making platforms understand what policies, how they are impacted by these policies, and possibly be able to develop a youth design and led accountability framework which will assist in measuring progress of all these key interventions and holding stakeholders accountable. And this will also ensure that young people are aligned with the global and national goals, such as the Sustainable Development Goals, the Global AIDS Strategy, the National Strategic Plan for HIV, TB, and STIs, and the GBV one as well as the Youth Health Policy and other key policies that have created an enabling environment and a conducive around ensuring that these changes are effected. And also interventions to help us move forward and make that much needed progress already to ensure that it already exists, and particularly in light of all the presentations that have been made today. So the key area of optimization is coordination, integration, and collaboration between all of these different stakeholders. And we need to evolve our understanding of the HIV response beyond biomedical interventions, social grants, and interventions that continue to support dependency on the social and healthcare system, particularly for young people who are no longer minors and in grave need of economic opportunities. And also the integration of services and programs will allow us to respond to the young person's needs in a holistic manner, as aforementioned, and also ensure sustainable capacitation for the young person. So also quite critical. And lastly, instilling youth responsiveness is also fundamental in ensuring that young people are not only conscious of their rights as stipulated in all these key policies, but also take the responsibility of ensuring proactivity, maximum economic participation, social responsibility, positive social behavior, and consistency in all key areas of their contributions. And one of the key recommendations mentioned in the National Youth Policy is that young people must familiarize themselves with the Constitution and the Bill of Rights, but also ensure that they also align themselves with the Bill of Responsibilities to ensure that they accept the call to responsibility that comes with the many rights and the freedoms that they have been privileged to inherit from the sacrifices and the suffering of those that come before them. So young people should be prompted to play their part by using condoms consistently and reducing the number of their sexual partners, initiating and adhering on PrEP and other tools, taking contraceptives, reduce alcohol and drug abuse, and also alter their sexual behavior. So to help us unpack a bit more and maybe to respond to some of the key issues that were raised in their presentations, we have our presenters, which had already been introduced. So I'll dive straight into the questions. So I'll start with you, Mr. Debeila. What can we do to enable more research on the risk factors for perpetrators of rape or sexual and gender-based violence, given the high numbers of teenage pregnancy and underage pregnancy?
I believe that question was for Sego Debeila. If we could add Sego to answer that question.
Thank you, Goga. So could you please repeat the question for me, please, if you don't mind?
Absolutely. So the question is, what can we do to enable more research on the risk factors for the perpetrators of rape or sexual and gender-based violence, given the high numbers of teenage and underage pregnancies that we see recently?
Thank you for the question, Koketso. And I think it's a very pertinent question that you are raising. Given the high number of teenage pregnancy, unwanted and pregnancy in South Africa, I think what we need to do, we need to have first of all, I would say we need a collaboration of the different sectors, public sector, non-governmental organizations, as well as civil society organizations, to really look at the underlying factors. What are the things that really push or are pushing for the risk factors for teenage pregnancy? Most of the times, I think we focus more on treating the symptoms of the problems rather than really looking at the underlying factors. What are the underlying factors? That's where we need to start at. Then once we identify those risk factors, and then we come together and address the the underlying factors. For an example, as CDC, you may have seen the model that I have shared, which is the PEPFAR South Africa Dreams package, where we really look at the different interventions targeting the adolescent girls and young women, but also the adolescent boys and young men, their families, their caregivers, and also interventions that really looks at or targeting the communities, the community leadership and the people at large. So I think that's the way, that's the most you know effective way to be able to address this culture of teenage pregnancy. Firstly, let's identify the push factors. What really puts or push young people, to for teenage pregnancy. And then once we identify the underlying factors, then we can try to address those underlying factors.
Thank you so much for that response, Mr. Debeila. And just to urge speakers to please keep their responses to 2 minutes, given that time is really against us. I'll go straight to Ms. Nogoduka. What can the Department of Basic Education do to close the gap for AGYW and ABYM to access comprehensive sexuality education during COVID-19 and in future pandemics, and to also create those safe spaces in schools and in communities?
Thank you very much, Coceka, for that. Ladies and gentlemen, as I have indicated as DBE, that we have embarked in the digitalization space. We are digitalizing the comprehensive sexuality education component in line with the rest of the curriculum that as the department we are endeavoring on. But I think I just want to agree with the first speaker to say, remember CSE is part of the life orientation subject. So it's a curriculum and it's limited time in the classroom. The rest of the work needs to be done as co-curricular and outside the classroom. So bringing in parents, communities, and all sectors of society will really take us forward with protecting our girls as well as our boys. Thanks, Coceka.
Thank you so much, Ms. Coceka. I'll speak to Mr. Muchenjekwa. How does the peer mentor program involve the partners of AGYW, and what are the challenges do you face in involving them? Mr. Muchenjekwa. Okay. As we wait, maybe for him to come back online, we'll then move on to Dr. Garnett. What is the role of the private sector to ensure that accessibility and supply of PrEP and other biomedical interventions to adolescents is maximized, given that we know that the costs, particularly for these particular tools, may really be driven up? So how does the private sector aim to play a role to really maximize beyond what currently exists?
That's actually a very good question, and thanks to the participant for raising that. And I do sit in a very particular space where I've experienced all sides of the spectrum, from being a clinician within the public sector and looking after people and young people with HIV and people at risk of HIV, to then moving into the research space within NGOs where we research methodologies of preventing HIV, to now being on the other side with the manufacturers of these medicines, right? So that's why I say it's a very, very good question. So there is a need for all sectors to collaborate. And I think that's one of the things that we've missed in this over 3 decades of this pandemic, that maybe we did not necessarily have a unified voice. There were pockets of us sitting in different spaces trying to solve the same problem. And that is why I'm so grateful for this platform. And thanks to UNICEF, SANAC, and the Department of Health and Basic Education, bringing us all together so that because we're all part of the same chain, right? So in terms of affordability, in my introductions, I'd said that Cipla, the pharmaceutical company that I represent, was a pioneer of affordable ARVs globally beyond just South Africa. They came in the early 2000s where medicines were exorbitantly expensive. They brought them to different countries for less than $1 a day. But beyond that, their company, and it's also because of that, it's forced other companies to also bring in medicines at affordable pricing, right? So PrEP has been available in the country for over 7 years now. I remember our first guidelines were in 2015, guiding clinicians and healthcare providers on how to prescribe PrEP and look after people that are on PrEP. So medicines are available and medicines are affordable, and they're actually even available in the public sectors. So where we've missed the mark a little bit, and with our Cipla Live to Love game, where what we're trying to do is create demand, because at this point the medicines are available, but we're not necessarily seeing young people that are at risk or people at risk coming to the clinics, coming to the doctors, GP practices, asking for this service. So we are raising the awareness so that they can come. And from this end, the healthcare providers have the medicines, they are affordable, they are available in the different spaces, whether public, private, NGOs, etc.
Thank you so much. Thank you so much, Dr. Garnett. So maybe to give Dr. Thato, because I see she's back on the platform, an opportunity, maybe a little more than 2 minutes, maybe 3 minutes, to just take us through how will the Department of Health strengthen the relationships with the Department of Economic Development, the Department of Higher Education and Training to address the structural drivers of HIV, with specific reference to economic opportunities and access to higher education. And we do understand that the mandate of the Department of Health is, of course, biomedically centered, but how do we find those synergies and how do we ensure that we bring in all of those different stakeholders to address this very persisting challenge that is social and structural drivers of HIV? Over to you, Dr. Thato. Okay, it seems that you are back on the platform, but you may still be having challenges. But then we'll move on to Hilary Nkulu. So how do we ensure that the GBV National Strategic Plan for HIV, the GBV National Strategic Plan, as well as the HIV NSP objectives are aligned, and how do we ensure that this particular NSP on GBV finds expression in all our prevention response efforts? Hilary, are you there? Okay, we seem to be having a challenge with reaching the colleagues. Okay, so I will then propose maybe to ask any of the speakers, maybe to respond to this particular question, that conceptually, how do you describe the interlinkage between structural and biomedical interventions to strengthen HIV response for adolescents? Because I think one of the persisting themes in this particular discussion today was those interlinkages, those collaborations. But how do we ensure, how do we see them pragmatically? How would we describe these interlinkages between these two different elements to ensure that we strengthen HIV response? Any of the speakers can respond to that question. Maybe to give back the question to you, Phineas, is there anything you can respond to, particularly on the question I just asked? Colleagues, can you still hear me?
Yes, Coceka, we can hear you. This is Thato.
Oh, okay. Thank you so much, Dr. Thato. I actually had a specific question for you, particularly because you could not present given the challenges that we had. But I think it's quite important for us to answer this question. The question that I had asked you was, how will the Department of Health strengthen relationships with the Department of Economic Development and the Department of Higher Education and Training to address the structural drivers of HIV with specific reference to economic opportunities and access to higher education? And we are quite cognizant of the fact that the Department of Health's mandate is really health broadly and biomedically centered. However, how do we find these synergies as already aforementioned in this particular engagement? How do we as a department bring in all the different partners to respond to these persisting social and structural issues?
Right. As you have rightfully said, and I'm not sure if I even still have any time to do the presentation, but let me try and respond to your question anyway. As you rightfully said, the Department of Health's core mandate is health, mainly biomedical interventions. However, we're very much aware that biomedical interventions on their own are not able to give us the goal of combination prevention, which is why we actually work as per the objectives of the NSP to work on a multi-sectoral approach to ensure that we reach our young people in all spectrum or in all aspects of the spectrum. We would remember that in 2016, we put forward the She Conquers campaign. And within She Conquers, all the 5 objectives included basically education, health itself, entrepreneurship. We made sure that young people are able to, or we are able to reach the young people with all aspects within the objectives. So all we could do, as much as we focus mainly on biomedical interventions, we use communication and IEC, demand and creation, to ensure that we're able to call on everyone to respond on a multi-sectoral approach to ensure that we don't only respond to biomedical interventions, but also to social as well as structural interventions. As we know, our policies are quite progressive. So we do have space to accommodate all spectrum in terms of combination prevention in general. I hope that responds to you.
Thank you so much, Dr. Thato. Well said. Maybe with the last 2 minutes that we have, maybe to ask any of the panelists, kindly please volunteer, just to speak specifically to this concept that we've been, persistently talking about throughout the conversation we've been having today of the interlinkages. How do we ensure that we bring in the structural and biomedical interventions to strengthen HIV response among adolescents? How do we, in fact, practically do so beyond, aligning ourselves to the strategic documents that guide us, but how do we ensure that that finds expression in the work that we do? Maybe I'll give it to you, Hilary, if you're still on the platform.
Yeah, no, thank you very much, Coceka. Can you hear me now?
Yes, I can.
Okay, great. No, thank you very much for that. And I think as Dr. Thato has indicated, if you look at our campaign that is targeting adolescent girls and young women, the She Conquers campaign, it really does speak to the 3 areas which we need to be targeting. So we're not only looking at the biomedical, but we're also looking at the social and structural drivers. And this being a national campaign, all our implementing partners in the country, be it PEPFAR or the Global Fund, they have all aligned with the She Conquers campaign to ensure that at any point, at any given point, when interacting with a young woman, an adolescent girl and a young woman, we don't only offer biomedical services, but we also offer the structural and behavioral change interventions, be it, focusing, doing screening on, other issues, be it gender-based violence, but also we're looking at, nutrition, we're looking at psychosocial support, and most importantly, especially in our economic climate, is also looking at the economic strengthening and livelihoods component. So those are just some of the examples when it comes to the package of services that are provided to AGYW across our programs that are being implemented in the country. So it's really about providing a comprehensive package of services that does not only address the biomedical needs, so we're not only limited to testing as well as treatment, but we also look at other aspects of a young person. And as I indicated in my talk earlier, we really need to be looking at a person more holistically rather than their health needs. I hope that answers the question. Thank you.
No, thank you so much, Hilary. And maybe without wasting any time, thank you for engaging quite meaningfully in this section of the program, and really responding adequately and giving us a bit of hope and shedding some light in terms of those key interventions that do exist, and how we can then find those linkages and ensure that we strengthen our efforts in a collaborative way to ensure that we respond to the needs of young people holistically. I'll bring it back to you, Marcelle.
Amen. Couldn't have closed it off better. Thank you so much. Koketso Ratumba is the National Youth Ambassador at the South African National AIDS Council. Thank you so much for running that plenary, even though we only had a very short amount of time, an important discussion that I'm sure will continue outside the realms of this webinar. Thank you to all of our presenters. Really such great insights, such important information being shared amongst us, and so thankful that we continue to work across silos, be it in government, the NGO space, and the medical and health profession space as well. You've been watching this very special webinar as we commemorate World AIDS Day 2021, and the topic was centering adolescent girls and young women in the HIV prevention and COVID-19 responses, and engaging adolescent boys and young men. And this discussion has been brought to you on the platform provided by the Mail and Guardian and hosted by UNICEF, the South African National AIDS Council, and of course the National Departments of Health and Basic Education. Thank you so much for joining us. Please feel free to share and distribute the YouTube link to this discussion as we continue to try and reach out to those most vulnerable in our populations, right here in South Africa, in Southern Africa, Sub-Saharan Africa, the continent, and indeed the world. Thank you so much for joining us today. We'll catch you next time. Take care.